And so what did we do? These folks, they ended up coming around a table, and they kept talking about this notion of culture. And the staff were talking about this notion that we have to fix the culture. I thought, what are you talking about? And so we started to unpack that. What do we really mean? And essentially we came to the common understanding that for us, culture meant what happens when nobody's looking. And it's those little micro moments when people are making decisions. Those micro moments, there's no one standing around saying this is the way you got to do it, but those micro moments of just how you behave. And so we thought if we're going to influence this thing called culture, we actually have to tackle looking at that notion of decision making. Because what do we want it to just be second nature in terms of how people be thinking and working? And we decided that the most important factor was around how we made those decisions, and that we decided to put a stake in the ground that forever changed us. And that stake in the ground was saying with our whole organization of making the commitment that any decision in our organization where there's a material impact on the experience of patients, a patient will be at the table. Just think about that for a moment. Think about all the decisions you make as a clinician, as a leader, as a policymaker. Every decision that has an impact on the experience of patients, a patient will be at the table. It was daunting. But we decided that if we were going to take this notion also of nothing about me without me, which was kind of just starting to get socialized in terms of out there of thinking, okay, if we involve and engage people, we had to actually do it. We couldn't just talk about it. We couldn't have committees forever to figure it out because we had a lot of challenges to solve. So we just got going. We just rolled up our sleeves and we said, let's get going. So we didn't spend a year planning it out. And that's one of my biggest messages. You got to just do it. You got to get in there and do it. And if you spend your time all trying to figure it out and make it perfect, you will not move because it's hard and it's uncomfortable at first.